Friends, welcome to another informative segment of Healthcare for Life brought to you by Community Health Centers of the Central Coast. My name is Jose Guzman and I have the honor and privilege of being the Director of Outreach Services for this wonderful organization located in northern Santa Barbara County and throughout San Luis Obispo County. During National Health Center Week, we are taking the opportunity to get to interview some of our wonderful staff who are providing very important health services throughout the Central Coast region. Today it is my honor and privilege to introduce to you Juanita Pineda. She is the Health Center Manager at Community Health Centers in the city of Guadalupe. Juanita, thank you for being with us today.
Thank you for having me, Jose.
Juanita, please tell us a little bit about yourself and your current position at CHC Guadalupe.
Of course. I'm Juanita Pineda. I'm the Health Center Manager for Guadalupe and the New Cuyama Clinic. I've been with CHC for about 6 years now, and it's been one of the most rewarding careers in my life as I've been seeing and interacting with patients, patient care, coming in and taking care of our patients.
As the Health Center Manager of the only health center in the city of Guadalupe in northern Santa Barbara County and the only health center in the community of New Cuyama, what are some of the great rewards that you receive on a day-to-day basis in your career and in your current position?
Of course, being and knowing that we are the only clinic out there brings a great joy and satisfaction that we are reaching out to these patients, that we're bringing the health equity to these communities out there, because they all deserve, everybody deserves to have equal care provided to them.
Mm-hmm. Excellent. As CHC offers health services throughout the community, tell us a little bit about the various health services that are offered at CHC Guadalupe and also the important health services that are offered at CHC New Cuyama, being that this is such a rural community.
Of course. So we do count with family practice, which focuses on pediatric patients, all the way to our geriatric population. We also count with pediatric, focus on pediatrics, as well as behavioral health, which counts for behavioral therapy and psychiatric services, nutrition and health services, as well as chiropractic services and dental.
Excellent. We know that the community of Guadalupe is influenced by agriculture. A lot of the people that live in the city of Guadalupe work in local agriculture. Tell us about the service hours at CHC Guadalupe and also how you accommodate those folks that get off from work late, and how you assist them in getting their appointments scheduled in the afternoon or late afternoon so you can accommodate their health needs.
Of course. So we are open Monday through Friday, 8 a.m. to 6 p.m. and with our last appointment being 5:30 to help some of those patients that do work, do have the workforce. We have that availability for them.
And also, CHC, Community Health Centers of the Central Coast, is known for identifying and removing what we call barriers to care that some of our patients face, right? What are the most common barriers that the patient population faces at your health center, and how do you help them manage those barriers to care so they're able to access those much needed health services?
Of course, there are numerous barriers, but the ones that do come to mind that we do see day to day in our clinics is transportation, language barrier, and also financial barriers. So we are there to help with the language barrier. We do provide and we do support them with all of our staff being bilingual in English and Spanish, and we also count on a translation line in case we do have a service or a language requested that we are not able to provide at the moment, but we do count on that. And then we also count on linking our patients and our members to transportation. CHC does have a transportation program that takes our patients to and from their appointments. And then finally, we do have professional staff in front who help our patients that are unable to provide or pay for their services. We either link them or enroll them in government contracted programs so that they receive their preventative care without pay. And then also for those qualifying patients, we do offer sliding fee services that is based on their income so that they're able to afford this. But regardless, Jose, we do not turn any of our patients away regardless of their inability or ability to pay.
Excellent. And for those folks that maybe have second thoughts about calling and making an appointment because they may feel that they will not be understood, like you said, we have the certified language line. You have staff members that are also bilingual. Folks that maybe don't have transportation, can't drive, then CHC is also willing to assist them in finding resources. So that's also very important. And that's what we identify as barriers to care. We want to make sure that people have the services when they need them, and we help them manage those special situations. Juanita, as we celebrate National Health Center Week, you and your staff have chosen to recognize the contributions of the farm worker population. Why was it so important for you and your team to honor the farm workers?
Well, as you mentioned earlier, a lot or majority of our patients are agricultural workers, and we wanted to acknowledge them and see them and make them know that we do appreciate their work, not only in the fields, in the work that they do, but also in their families, and then the way we care for them in the clinics when they come in to see us.
Many times folks just see our logo, CHC, but it's great to put the face of a dedicated CHC staff member so that folks can see and actually hear how dedicated we are and how willing we are to assist them with their healthcare needs. I had the opportunity to visit your clinic, CHC Guadalupe, a couple of days ago, and I had the opportunity to also to see the great artwork that your staff put together. Tell us a little bit about that artwork that was created to honor local agricultural workers.
Of course, this piece was really close to heart. We took a poster, and every patient or community member that walked in, we asked to give us a fingerprint. So these fingerprints were part of the agriculture or the field per se, and we arranged it to somehow display a field of strawberries, and then on there we also portrayed the sunset. On the sunset we have our loved ones, our patients, and not every, but all of our members who are really close to our hearts that served and dedicated and gave their life to the agriculture workforce. So even though they're no longer with us, it's a part of a memoir for them and the work that they did.
Many members of our community are very grateful for the services that we offer. Can you tell me of an experience that you've had with a patient that may be an agricultural worker, and maybe that day they are working, harvesting strawberries, harvesting lettuce, and they're so thankful to the staff at CHC Guadalupe that they actually come in with various types of crops to say thank you? Does that happen?
Yes, often. Actually, one of our patients that's on the memoir, he didn't really have a family, so he saw us as family. And he passed about a month ago, and it was a way of remembering him.
Yes.
He would bring us whatever he was harvesting, and it was just beautiful to know that, let him know that even though he's not here, that we remember him and everything. You know, for him it might have been maybe insignificant, but we saw that and we appreciated that gesture of him. But our patients are very loving and very giving.
Yes.
And that's their way of saying things to us, and we take that with us, and we're very grateful for that.
That's excellent. That's great to hear. The contributions that our patients make to us and the contribution that we make in the health of those patients. And I'm sure it's a great legacy that this patient left behind, and the friendship, the bond that was created with the staff at the clinic. And I know that having someone like you as a health center manager makes a huge difference also in how the services are delivered to many folks that are facing many barriers to care. I know I myself would be glad to receive health services at your health center there at CHC Guadalupe. So during National Health Center Week, Juanita, we recognize and thank our patients for trusting us with their health. That's something that's very important, right? They want to achieve greater health outcomes, we as providers want to make sure that they achieve those outcomes. What message of gratitude do you have for our patients or for our future patients that you would like to share with them today in terms of trusting us with their health?
Well, I just wanted to say that at CHC, Guadalupe, and Yokoyama, and pretty much anywhere, all of our CHCs, we treat our patients like family. So when we come in, we are taking care of you as a whole. There's no judgment. There's no questioning as to how you're feeling. It's that connection. You do that with your provider. We're here to connect. We're here to guide. And we're here to provide that services and linking patients to whatever service they need.
Excellent. Juanita, thank you for your time and also for the dedication and the quality healthcare services that are offered to our patients at CHC Guadalupe, at CHC Yokoyama. Since I first met you, I noticed that you're a very dedicated, passionate, and humble individual. And when I had the opportunity to meet both of your parents, I see where that comes from. The fruit doesn't fall from far from the tree, right? So congratulations, and thank you for all you do for our patients at both of these health centers.
Thank you. And I did want to close saying that wherever, if there is established care or not, we are here to serve you, to provide, and really be there for you, which is something very distinct from other clinics. We take care of the actual person, regardless of their background, regardless of what was done or what wasn't done. We treat everybody with a clean slate, and we just link them to what we need.
Excellent. So happy National Health Center Week. I look forward to speaking to you in the future so you can provide us with more information regarding both of these wonderful health centers.
Thank you, Jose.
Thank you. And thank you also for taking the time to watch this very informative segment on Healthcare for Life. My name is Jose Guzman. Until next time.